Good morning, good afternoon, good evening, wherever you are. This is Firoz Manji from Daraja Press. Welcome to Perspectives on Organising in the Time of COVID.
They don't go to work. They don't go to work. They don't get food. They don't go to work. They don't get food. They don't go to work. They don't go to work.
Hello.
Good morning, good afternoon. My guest today is Banamallika Choudhury, who is a feminist social activist and development consultant based in Guwhati, Assam, India. She's the executive director of Women's Leadership Training Center and co-founder of NEthing, an art and culture collective for social change. She does feminist participatory action research, writes on gender and social issues, and organises on women-led grassroots feminist actions to address the issue of gender discrimination. Welcome to the show. Can I call you Mamu?
Yes, you can. You can. Thank you.
Welcome to the show, Mamu. Thank you for joining us.
Thank you. Thank you, Firoz.
So tell me, you've been working with an organisation to produce a book which is about it's called Her Lockdown Story from Assam, which was published relatively recently. Can you tell me something about this book?
Okay. So the book is actually kind of a what is it called? Like a byproduct of a survey that we had done on impacts of the COVID lockdown, COVID-19 lockdown on women in Assam. So when in March, once the first phase of lockdown was announced, and we were, our organization works with basically very grassroots women from very grassroots, in absolutely rural grassroots areas. And we do a lot of leadership building training with them. So we have women leaders who work in these communities. So when the lockdown happened, our first thing was to, we called them up. We said, let's find out who is doing how, how people are managing and all of that. So, in the first week or so, when we called everyone said, no, we are fine, we are managing fine, and, it is going to be a break for a few days, and I think we will manage. And no one had kind of anticipated what this could mean, no one, anyway. So anyway, and then by the second week of the lockdown, we started receiving calls from the women saying, there are people who are not getting food. There are people who are not being able to go and work, like people who do daily wage work. So they go find work daily in the town or in, construction sites or, that kind. So they were not being able to go. The vegetable sellers were not being able to sell their, go to the market, sell their things. And, a lot of these things were happening. So we started getting calls saying that now people are in trouble, what can we do? And that's when we said that we need to do a quick, we need to understand what is going on and what the, impact has been. So we started talking to the women. So, and this is lockdown. So normally when we do, research, that we go into the field, collect, meet people, and this is COVID-19. So we can't meet people, we can't organize any meetings, So this is the situation. We said what we can do is over the phone, we talk to women. As all the community leaders, women leaders will be talking to as many women as they can from the community to talk to the women around them and connect through phone. So we did this survey in where women shared. I'll share a little more later about what we exactly found, but let me just give you the story of the survey. So we looked at how their work has been impacted, whether food security situation, where they have that or not, what's happening inside the house, are they, is there more work? So these stories started coming. And then we started, they were sending us photos, they were sending us kind of what we in development language call case stories, of women, like this is what is happening with this woman, that kind. So we decided to put this up on Facebook. We started, there is a page called COVID-19 and Women Experiences from Assam on Facebook. So we started putting up stories there. And that's when my friend Srijata Gupta, who is, she's otherwise a primatologist and a writer. So she called up and she said, these stories are very, very, compelling. They are, let's do something. We also needed to, we were trying to raise funds. We were sending messages to all our friends and families saying that let's donate. Let's try and reach out to as many women as we can, let's help in this time. So seeing that, Srijata said, why don't you do this fundraising thing? We do a quick book, where we capture the stories of the women and we then sell the book and raise funds, So this is how it happens. Srijata wrote the stories. They're, kind of slightly fictionalized, and they're very, very well written stories. She also did illustrations for the stories, and and I had to come in as the editor. We chose the stories, and we got into what editing requires, what should be highlighted, etc. So that's how this is the story of the book.
Flavor of the kind of what is the story of low-income women in Assam in terms of the lockdown? What does it actually mean?
There have been so many. So there is the whole economic. There are part of the economic, impact that has happened, that women have lost jobs, etc. And then there is also this other side of women being stuck at home, doing more work, and also not. So interestingly, there was a lot of police restrictions and brutality around when people went out to, for example, vendors went out to sell things. And interestingly, it's this time when women started going out, because the police would beat up the men. So the women started taking up, so earlier, if suppose the husband was selling tea by the roadside, or selling, let's say, vegetables by the roadside, and now, or milk, there were a lot of, quite a few people who sell milk, So that the police would not let the men get out. So, and in which case the women came out and they started going with these things, that the police was little less brutal with women, or at least the women could, fight back and not get beaten up, physically harassed, all this. So so suddenly there we also see a change in the gender role, or at least an expansion in the role that women play in the house, where earlier they took over the income earning part. If they do the men's income earning part, they did. We also saw in Assam, as well as in other parts of India, a very, it's very unfortunate, but we saw that the Muslim community in particular was targeted in the beginning. Was ideal because of this. I don't know if you know about it. There was a Tablighi Jamaat thing that happened in India. So this
thousands disenfranchised from voting, isn't that right?
Yes, that's also from Assam. That is also from Assam. It is not just from voting. So it's from there. We had a sudden, the National Registry of Citizenship, in which it was it's the process. It is a very. It's not possible to actually register. So I find it funny actually to register so many millions of people. India has not been able to, for example, they don't. There is not one single registry where India can tell that we have so many people. Even the census is like not complete, never comprehensive. It's like that. And then they decided they are going to do this National Registry of Citizenship. There were a lot of issues in the registration, but the idea was that there are people from. The idea is that there are people from Bangladesh who have come into Assam. Assam borders Bangladesh, so and they are all illegal immigrants. So now we do this registry, and then we identify people who are not really true citizens, who are doubtful citizens, doubtful voters, and and then we will do something with them. There are also detention camps. A lot of people were put in detention camps. Although this process then could not complete, there was a final list that came out from where about 19 million people got left out. But then the government is supposed to now issue this then is supposed to go to another level of called the Foreigners Tribunal, where people can go and now fight a case saying that this is you have said I am not a bona fide citizen and this is not correct, and here is my paper. So that for that process, the government has to now give a reason, issue a notice giving exact reason why this person's name was not included in the list. So that process got they were because of COVID, and two, then it seems that in between they tried issuing some notices to some people, but then there are again problems in that as well. So given that there is already there are already communities who are very, very marginalized, and who are very marginalized. They face social discriminations, they're economically marginalized. And then there is the whole, Hindu-Muslim thing, when Muslims being looked at as, dirty carriers of disease, etc. So this kind of suddenly saw in the rural setting in particular, actually also in the urban setting in particular, saw and along with in the COVID situation, saw that there were restrictions. There were villages, non-Muslim villages, where they would not let Muslims use the road that passes through their village. And in Guwhati, the city I live in, for example, the domestic workers were suddenly housing societies, like apartment buildings have this thing called residence society, like residence, whatever organization, not a very formal organization, but so associations. And then they took decisions like that, we're not going to let Muslim domestic workers come in, etc. So this we saw. We also saw, domestic workers in terms of women. This was quite something that 90% of domestic workers were, one, they lost they couldn't work during that period, and secondly, they were not paid. They, although they are actually regular workers, some of them work with the same employer have worked for more than 3 years or 2 years, 1 year, whatever long period of time, but they were not paid for the time. Can you hear me?
I can hear you very well.
Okay, great. Because I get a message saying that my connection is poor. So
we're not actually seeing you move at all.
Okay.
Your screen is just frozen, but we can hear you perfectly well.
Okay.
Perhaps we can go back to the book.
Yes.
And help us understand, when you're talking about low-income women in Assam, who are these women? Are they farmers? Are they workers? What? Give me some idea.
We try to cover women from different, backgrounds, or women who do different kinds of work, because we wanted to see that. So there are farmers, there are women who do daily, what we call daily wage work, which is, it could be anything. Like, for example, in this lockdown story, there is a story of a farmer. There's a story of a woman who goes, and she does, what is it called? She lifts things. She carries things in a shop. She goes to town every day, and in a grocery store, she lifts these heavy bags. Carries basically things for porter. It's called porter, right? Yeah. So she does a porter's work. Sometimes she would also go and work in road construction with contractors who, if there is a road construction work going on, there she would work as a laborer. So these are very informal, insecure, daily paid jobs. So if you go, you find job. You may find job every day. You may not find it job every day, and then you get paid if you do the work, and otherwise you don't get paid that. And then there were women who work in the tea gardens. Assam has a lot. It produces a lot of tea. Assam tea is quite famous, if you know.
Yes, yeah.
So we had women from the tea.
So just going back to the sort of casual workers, what does lockdown mean for them?
It just meant a complete loss of livelihood. It meant complete loss of livelihood for them. So there was no work, no pay, and mostly they are like from the poorest section, poorest section. So they don't have savings. The ones who live in the cities, most of them live in rented houses, so they have to pay rent. So it just meant a complete loss of livelihood, as well as and which then led to loss of food security, and most people, although Indian government had announced a food support program, which is for people who are supposed to get 5 kgs of rice per person free. For people who have this thing called the ration card, which is a card you have where you get free or very, you pay 1 rupee per kg, that kind of, it's a food security program basically Indian government has. And so they said that they will get 5 kg of rice. But most of these people, for example, the daily wage workers, do not have the ration cards. So they are the people who fall through the gaps. So they were severe food
So,
security issues.
so if they lose their livelihood, I mean, how do they survive? I mean, if they're
Oh,
because they,
I know. We have been asking. No, it's been tough. It's been tough. In the rural areas, actually, still, people can get, let's say, they can forage. A lot of people did that. So they would go and collect roots and vegetables like yam and other leaves and whatever for food. But they did not have any money. This was some probably would borrow money, the neighbors would give or their friends would give a little bit. But it was also for a long time. 3 weeks is a long time for. In urban areas, it was even more difficult. A lot of the people, that is why we also saw a lot of the people left for their, whoever had like a home in the village, so they left. We saw the whole migrant workers in the movement in India that happened. Thousands of migrant workers just walked for thousands of kilometers to home. So in Assam, similar thing happened. People went home or they borrowed money. A lot of them have lost homes. So now on the street, we're seeing in Guwhati, for example, every day I see an increase in the number of people who beg, on the street.
right.
Yeah. So it's quite a severe situation. I mean, we reached out. A lot of the civil society organization did reach out with food support around that time, giving people food, like food packages basically, to last them 2 weeks, 1 month, whatever. Yeah.
One of the things that we talked to somebody about the situation in India, talking about farmers, that many of the small farmers are simply unable to get their food to the market.
Yeah, yeah, yeah.
And so there's all this food which is just rotting. And,
Hmm.
and, and parallel to that, in the towns, there is no food, or if there is, it's very expensive. Is that what is happening in Assam as well?
Yes, yes, that is happening. Also, what it's so, I mean, that happened. A lot of farmers had to, it was also a very, that March, that's a very crucial period for farmers, particularly small farmers. What happens is that this is the last of their winter crops, which is mostly cash crops like vegetables.
Hmm.
So vegetables, so they get, what they do is they sell the vegetables. This is the last lot they get out. By April they sell their, this is the peak time. They sell their produce, then they collect the cash for the rest of the year, and then they get into the paddy cultivation, which they would mostly do for their own consumption. They don't sell so much of paddy, so they have the money from the winter crops for the rest of the year. And this year, and in peak season, they couldn't sell their produce.
God, yeah,
Yeah, yeah.
yeah,
So this is, they had to just throw. There were photos from everywhere where, tomatoes, watermelon. Or, there is this, we call king chili. There is this very famous chili from Assam. So which fetches quite a good price for them, and it's difficult to grow. So harvest of king chili, all of this they have to just throw.
yeah, yeah.
Yeah, no, no. It was a terrible, terrible situation.
So, I mean, tell me something about the level of infections in Assam, and whether, in fact, all this lockdown is justified in that context.
No, it is not justified. When the first lockdown happened, till the first lockdown opened, Assam had something like 40 positive people, 40, and 4 deaths, but which were all comorbidity related death in cancer patients, mostly cancer patients. So in that time we had the lockdown, and then they said, then they opened up after the lockdown. They opened up and they said that, so because of the lockdown, a lot of people from Assam and the northeast who live in mainland India, we are quite far from mainland India. That you, I don't know we are in the northeast of India, which is a separate region altogether. Geographically we are actually closer to Myanmar and China than to India.
Yes.
So we're far from there, mainland India. So a lot of people wanted to come back home, couldn't come back home, and then the government said, okay, now you can come back home. Which just the opposite of what should have been done. It should have been done before the lockdown. You tell people, okay, there will be a lockdown, come back home if you want to, because people are not yet infected. But instead, what they did is they did the lockdown, and then the infection rates went. In mainland India, the infected, the infection rate jumped, and then a lot of people got infected, and then they said people can come, and then thousands of people then landed at home in Assam, by train, and when they opened the flights, then a lot of people came by bus, and suddenly there was a spike in infection rate, because a lot of positive people came in, although there were a lot of quarantines happening and all. But even then, now we also had the second, we in from July. When did we have this? From June till July, like we had another three weeks of lockdown. So this is just, the first 3 weeks of lockdown, just, people already made people lose their jobs, and push people, and not just the daily wage worker. A lot of businesses have not been, small businesses have not been able to open. So a lot of people who work in these small businesses, as it is, the entire economy is informal. Almost entire economy is informal. There are very few formal sector jobs here in Assam. And then this lockdown after lockdown, and there is no reason, because even now, although the number, it's even, that's not a very high number, something like 16,000 some positive cases, and about 100 and less than 200 death. And so the death rate is something like 0.02% or something like that. And the positivity rate, they have been doing a lot of tests, and the positivity rate is something like 4%, or this is the positivity rate, like out of the tests that they do.
Right.
So it's, it's not like that there was, yeah.
Yeah. So, what kind of organizing is happening amongst women in Assam?
At this point, the women are mostly talking about what is happening. Number one, that's one. And number two, bringing out, documenting their stories, what is happening. Also, the violence against women. There are a lot of groups which are documenting the increasing, rate of violence against women. And
So why is there an increase in the violence against women? Help us understand.
see, the why is, at this point, there is no such simple answers, but it is the economic stress is one of the reasons. Definitely, I have asked people, and I mean, our survey also, women said that the fights were mostly about the economic stress at home. Secondly, there is increased work burden. People are stuck in, small places for a long time, and as it is, it's a patriarchal society. So, or when you feel frustrated, you have the solution. You can just go and beat up the women. So this is what is happening mostly. And also that women can't now go, go out. I mean, that's the thing, that with the restrictions in movement, being locked in, and the stress related to the economic stress is one of the main thing. And there is overall stress, around this issue. I think that's one of these are things coming up. So the women are, yeah, we were talking about how women are organizing. So they're doing that, and we're also trying to. There are groups of women who are trying to see how they get the minimum support that they're supposed to get for their entitlements from the government. So because it's all in India, like the processes of just getting anything is so, no one knows what needs to be done, and then you have to show this document, that document. So we are saying that we're documenting that. We are we're supporting, we, at least in our path, we are now providing information to women to know what their rights are, what they can get, what are the entitlement and welfare programs available with the government, which they should then, and also informing their needs, informing the government on their needs. Then there are an organization I work closely with. We are part of the same network called Northeast Network. So they work with the government department to get an SOP out for SOP, systems and processes document out for. They didn't know, for it was happening that women would face violence, and then they needed shelter, and the government shelter homes were not taking women in because there is a testing issue, and the whole social distancing thing. So then, and police would not respond. Police would say, we are busy doing COVID duty. So this is the other thing. So then the SOP kind of puts in place how the police is supposed to respond, and what will be the testing processes, what protocols they will follow, and that they cannot deny services to women, and that they have to respond and prioritize, responding to women's needs. So these things, at least, formally at that level, women's rights organizations have been doing. This is how organizing itself has become a challenge at this point. One, because of the restrictions, we still can't do. We have inter-district travel restrictions, which is that from a district within the state, from a district to district, you can't travel every day. Then, yeah, when we travel to some place, we have to quarantine for 7 days. Sometimes it's 10 days. It's changing every day. So, normally when we organize, we get together. And that's the for women, and getting out of the home and coming into the safe spaces of where we hold, meetings, protests, gatherings of women. This has been our primary organizing tool. And that is now not there. And as it is, we are limited. We have limited resources, not through phone, Zoom, or any of this video. This kind of technology is out because the women in the communities do not have access to any of this. Yeah.
One of the things that we've seen in places like Kenya, in South Africa, and a number of other countries, is that there has been a militarization of the streets. There has been real violence by the police against people, especially those who are in the slum areas and so on. And they've even gone as far as implementing a curfew. And is that something that you've seen happening in Assam? Is there a greater police presence? Is there greater violence against people?
Well, the presence is not greater. We already live in a very militarized place. Northeast, other famous. Why we are famous is because we are a very heavily militarized area within India. Because one, we share borders. Northeast, actually, the entire region shares. India has Pakistan, China, Nepal, Bhutan, Myanmar, Bangladesh, 6 borders. So out of which we share 5. Northeast has 5 of these borders. So so we are a border area, international border area. Secondly, we have also had a very long history of insurgent movements. There have been groups which have wanted to separate from India. There has been groups which have so there are different identity-based armed groups, and so there is a history of conflict in the area. It's a very, very heavily militarized area. So in that terms, we have seen worse times, I must say. So we are quite used to seeing military and police. But yes, on a regular basis, there were people couldn't go out. There were a lot of beating up. Recently there was a case of when this policeman. So this father had taken his disabled son, who is about 16 or 17 years old, had taken him to the pharmacy on a motorbike. So the son was behind him, and he had to be taken to the pharmacy to get for something. And the police, without actually checking where they are going, whether they are violating, why they are violating, there is supposed to be a 6 o'clock curfew, like after every 6 o'clock every evening we cannot go out. We still have that. So without checking why they were going out, he just hit the child with what you call the stick, the stick that police carries. And then this came up in the father posted a video on Facebook, and then there was a lot of uproar. And then the police, the higher officials said we are taking actions, and it seems they have suspended the police on duty, etc. So this is just an example, but yes, there has been a lot of police brutality. People just couldn't go out. But in terms of increasing, because we are already in a heavily militarized area, we don't. I don't feel like there is an increase. Yeah.
Right. And you've done work with some of the queer communities as well. I mean, what's the situation that they're facing in this current situation?
They also, queer community is also in a very, very, particularly, so again, there is the class thing also that's come into queer communities. A lot of people have lost jobs, 1. 2, if we look into the Indian queer community, then there is a large section of them called the Hijras. I don't know if you know about the Hijras. They're basically trans women, traditional. So Hijras, they do their earning is mostly through actually begging, or they go to people's houses in festivals. They play a traditional role where they give blessings and then they are given money, or they just go and ask people, mostly begging, or asking people for money from shops or in buses, etc. So that that source of living, they couldn't obviously they couldn't go out, and their source of living again, they lost their livelihood. So they were in grave situations. We had reports that, and then they were the and we've been talking about these things, and there has been people being stuck at home, people who are not open, not out to their families, and now having to spend endless time within the house, and not being able to share their issues, they're not being able to talk about that. So there is a lot of mental health issues that have come up. As it is, there is a high rate of mental health issues amongst the queer community. They couldn't seek help. They couldn't seek help because they're not out, and this had happened. People, yeah, there were also cases of and another. I'm just sharing a lesbian couple who lived in a rented house, and now because they were staying together in the house, the landlords kind of got to know that they're lesbians. Earlier he didn't know, and then he reported it to the place where their workplace, their families, and then their families started came to take one girl away, and then the families have been abusive, they have been threatening them, threatening. So all these things are happening with the queer community as well. The queer community is also keeping in touch, organizing, trying to reach out to each other, through either economic support or or talking, and talking about, there's a lot of mental health support groups within the queer community which is happening. Yeah.
Right. So, I mean, going back to your recent book, you edited, Her Lockdown Story. Is there any final message you would like to convey to people who are listening or watching this show about the situation of her lockdown story?
Messages, yes. I mean, we all need to, we know what is going on. The thing is that we also see that there is such a, it's a systems it's a complete systems failure. We knew that the system has been, as a feminist, the system is not working out, and now we see that, and we see how the system is failing. These stories only capture, they show how the system has been failing so many people. So if we talk about, say, yeah, otherwise we are using the book for fundraising. If there are people from India, and then you can get in touch with me. Maybe my email is Banamallika, my name you can see at gmail.com. So that's quite easy. If you just get in touch with me, you can buy the book for 100 rupees or more if you want to. And that will be a great support. Or the money raised goes straight into, every penny raised from this fundraising goes to support the women. That is one thing. And otherwise, we need to talk about this. We need to talk about what other system we want to see. Then, this system is not working out. So all of us, in every way, wherever we are, we need to now say the new system that we want to see. We need to, organize.
Right. By just putting a link to a review of your book there. So
Yes.
I just want to say thank you for sparing time to be with us today. Mamu, I'm so sorry that your internet connection has been going forwards and backwards, and we've not had the pleasure of seeing you talk, but we have certainly heard what you have to say, and I think there will be a lot of interest in your commentary. So thank you so much for joining us.
Thank you for inviting me. It is great knowing you, and thank you for doing such wonderful work. You are really connecting a lot of people from all over the world. I can see that. Thank you,
Well,
Firoz.
that's very kind of you to say that, and I hope we will stay in touch.
Yes.
Thank you once again, and so let me just close off the end of the program with our banner. Thank you for all of you who've been watching this show and perspectives on the organizing in the time of COVID, coming all the way from Assam in India. This is Firoz Manji signing off for today.
They don't go to work. They don't get food. They don't go to work. They don't get food. They don't go to work. They don't go to work. They don't go